Hi, everybody. This is Melissa, the nurse from Regency. I hope that as we are sending you this message, everybody is well and healthy. We are posting this video to give you guys some information regarding the coronavirus. We could have sent this to you in an email or a text message or a letter in the mail, but during this time of social distancing, we wanted you guys to see a face from our agency to let you know that we're still here for you. We're still available to you. I'm still available to you, your coordinator, and the administration at Regency. We're real people still here, and we are available to you during this time. You're not alone. So, I'm going to talk to you a little bit about the coronavirus. You guys already know that the coronavirus was something that was identified in China, a virus that seemed to have started within animals, but then started spreading to humans, and now it's spreading very easily between humans. Any of us here in New York already know that there are thousands and thousands of cases here. So we're going to speak to you today a little bit about what the Department of Health is asking us to do to keep our patients safe and what we're recommending at Regency to keep you guys safe and to keep the patients safe. We're being told by the CDC that most people who develop the virus are not going to have severe symptoms. They're going to have mild symptoms, but anyone who has already underlying health conditions, so anyone who is already sick, and the elderly, they're going to be at risk for developing complications and could even possibly die. Our patients are elderly and sick, so we have a huge responsibility as healthcare providers to do the best that we can to make sure that we're protecting ourselves and protecting our patients from this virus. So the DOH is recommending that we screen all of our employees twice a day to make sure that they don't have symptoms before they go to work and at the end of the day when they leave. So in the morning, before you report to your patient, we're going to be asking you if you have a fever, if you have any symptoms such as fever, coughing, shortness of breath, or sore throat. And we're also going to ask you if you have had any contact with anyone who's been exposed to the coronavirus or with anyone who may be sick with the coronavirus. We're going to be asking you that again at the end of your shift. And when I say we, I'm really talking about a young man named Pedro. Many of you guys have probably already spoken to him. If Pedro calls you and he asks you these questions, he's not trying to be nosy. Please cooperate with him. He's just trying to get the answer from these questions to make sure that you guys are clear to go to work. Many of you guys are already cooperating with him, and for that, I thank you very, very much. We're also going to ask that throughout your shift, that you monitor yourself for those symptoms. So maybe when you first got to the patient in the morning, you were feeling fine, but then an hour or two into the shift, you're starting to feel feverish. Maybe you're developing these symptoms. If you develop the symptoms during your shift, call your coordinator, let her know. We're probably going to ask you to go home and get some treatment and evaluation from your primary care doctor. We're also going to ask that when you arrive to your patient's house, that you monitor your patient for these symptoms as well. When you get to your patient's house, see if your patient has a fever, see if your patient has any coughing or shortness of breath or a sore throat. If your patient or anyone in the household has any of these symptoms, call your coordinator so we can give you some more direction on what to do. We're also going to ask that while you're traveling to your patient's home, that you wear gloves and that you wear your regular clothes, not your scrubs, while you're traveling from your house to the patient's house. When you get to your patient's house, please wash your hands immediately. And remember, hand washing is 20 seconds minimum. scrubbing and using friction in between your fingers, underneath your nails, and past your wrist for a minimum of 20 seconds. When you're done washing your hands, you can remove your clothing, put on, sanitize your hands, put on your scrubs, sanitize again, and then put on your gloves so that you can start your workday with your patient. When you're providing personal care to your patient, please put on a mask while you're providing that personal care to your patient. The CDC is recommending a minimum of 6 feet in between the next person in the room. This is called social distancing. We're hoping that with social distancing, we can minimize the risk of spreading this virus between one another. In the home, it might not be possible to keep that minimum of 6 feet, depending on how big your patient's home is. So we ask that you maintain a good distance between yourself and the patient when you're not providing care. If you need gloves or mask, both offices have gloves and masks. They're going to be set up in a way that you can just go into the office, grab them, and leave, so that this way you're minimizing your exposure to anything in the office. And you're also not spending so much time in the office, and do not bring anything into the office. This is for safety purposes. While you're at your patient's house, please wash your hands often, please sanitize often, please use your gloves, and then at the end of your shift, report again your temperature, whether or not you're having symptoms, and then once you're done, change back into your travel clothing, put your scrubs in a bag, and go home safely. If you need anything from any of us here at Regency, we are here for you. Give us a call. Again, my name is Melissa. Keep in contact with your coordinators. We're going to be in contact with you throughout this whole um, outbreak. This video is going to count towards your in-service. So please watch this entire video. There will be questions on this video on your in-service when we have it later on this year. But in the meantime, what I want from you guys is to be safe, to be well, and I can't wait to see you guys at the next in-service. Take good care.